Welcome. I'm Dr. Crystal Foster, here with your Baylor Healthcare System Spotlight on Health as we take steps to get healthy, Texas. Today, our spotlight is on how to reduce your risk of stroke and identifying the risk factors. Joining me today is Dr. Graybill. Welcome.
Thank you for having me.
So, Dr. Graybill, can you describe to us what a stroke is and what's occurring in the brain when a stroke happens?
A stroke is a brain attack. What happens is a lack of blood flow, a blockage of an artery causes damage and symptoms of the brain, or due to a rupture of a blood vessel causing damage to the surrounding brain. Unfortunately, brain cells do not regenerate. Symptoms can include weakness or numbness of one side of the body, difficulty speaking, or even vision problems. Those patients that have already had a stroke are at high risk for having another stroke also.
So how quickly is medical attention needed during or after a stroke?
Immediately. We have patients that have had previous strokes, or if you have a loved one that may be experiencing symptoms of stroke, we tell them to call 911 immediately. Depending on the type, the location, how long the symptoms have been present, or where in the brain a stroke is, different treatments can be done, but immediate treatment is necessary.
So can you describe a person who's considered high risk for a stroke?
Different risk factors for patients can include things like high blood pressure or hypertension, which is the most important risk factor. But other important risk factors also can include tobacco use, diabetes, carotid artery disease, those patients that may have high cholesterol, physical inactivity, obesity, even family history is important.
Okay. So Dr. Graybill, thank you so much for joining me today and sharing this information. To learn more about the different types of strokes and treatments available, visit BaylorHealth.com/stroke risk.
Baylor Healthcare System paid for this segment.